Hello, and this is Dr. Scott. On this video, I want to talk about the 5 most common vitamin deficiencies in America. I want to begin by stating that vitamins alone are not the whole picture when it comes to health. Many health problems in today's society are due to vitamin and nutrient deficiencies and imbalances caused by many lifestyle and dietary issues. The standard American diet, or the SAD diet as I like to call it, is a big problem contributing to these nutrient deficiencies. For any of you who have children, and teenagers in particular, it's very easy to see the SAD diet in effect. It's amazing the amount of prescription medications our teenagers are taking. Asthma medications, allergy medications, headache medications, pain and inflammatories, and these are teenagers. So these are all, many of the kids I see today are addicted to grains and sugars, and this video won't get too deep into all the problems with the standard American diet. In this series of videos, though, I do want to discuss the 5 most common nutrient deficiencies facing Americans. Number 1 we're going to talk about is vitamin D. 3/4 of the American population is deficient in vitamin D. This essential vitamin plays a significant role in many body functions, including bone formation, calcium absorption, cell growth, neuromuscular and immune function, and decreasing inflammation. Low vitamin D levels are linked to an increased risk of major diseases such as heart disease, diabetes, cancer, and neurodegenerative conditions. A low vitamin D level also predisposes you to various autoimmune disorders such as multiple sclerosis and type 1 diabetes. Vitamin D is proof that God knew what He was doing. The darker your skin, the more sun exposure is needed to raise your vitamin D levels. So this is how we regulate vitamin D in our bodies. So if you're a fair-skinned person, your ancestors most likely lived in the north, or where there was less sun, and their skin lightened up over generations in order to optimize their vitamin D. And if you have darker skin, then your ancestors grew up in an area where the sun was stronger and you needed more protection, and that was how you regulated your vitamin D levels. And so in our current system, our current day, the problem is today that many of our darker skinned individuals living in the northern climates. So we can easily move from the equator to northern climates very easily, and our bodies don't have a chance to adapt. So many of us are becoming vitamin D deficiency. We also live in a culture where going outside with your clothes off is not very acceptable. So in order to optimize your vitamin D levels, you need to have a large portion of your skin exposed to the sun, like a bathing suit. So unless you live in an area where you go to the beach often, or you go by the pool, just getting out in the yard with your short sleeve shirt on and a hat isn't going to cut it. And an increased risk of deficiency in turn leads to an increased risk of other diseases associated with low vitamin D levels. In the past, doctors warned individuals not to supplement with vitamin D, stating it could cause cancer, hip fractures, or be easily overdosed and build up in the body, because it is a fat-soluble vitamin. Fat-soluble vitamins do stay in the body longer than water-soluble vitamins. Water-soluble vitamins can be flushed out of your system very easily and are hard to take in excess. But again, God designed fat-soluble vitamins to remain in the body longer because they're so important. And this is why it's important to get proper testing to optimize your vitamin D levels and to regulate whether you're in the right levels or not. The best way to get vitamin D is from the sun. But again, we've all been told that the sun causes skin cancer. And again, this topic deserves much more time, so maybe in a later video I'll be able to do that, some due diligence. But just some quick points. Vitamin D has been shown to be preventative in many forms of cancer, including skin cancers. Sunscreens only protect you from UVB, which is what the SPF is based on. They don't do a good job of protecting you from UVA and UVC, and these are the rays that actually penetrate deeper and cause more problems. And there's probably other rays we haven't even discovered yet. the melanin that your body produces protects you from all three rays. So again, if you can develop a nice healthy tan, then you're actually protecting yourself more so than by using sunscreen. Now, one of the things I tell my patients often is that, I'm a surfer and I do use sunscreen, but again, this is because I don't want to get burned. I try to optimize my melanin production to the best of my potential ability and try to protect myself as best I can. So again, the point is that our bodies need sun exposure to be healthy. Our ancestors evolved in the sun, and in fact all life on this planet evolved around the sun. So there are healthy guidelines for sun exposure, and again, that's a topic that we can maybe address on another video. So many people today are deficient in vitamin D because they are constantly slathering on sunscreen, fearful of the media warnings that sun causes skin cancer. And again, if you notice that the more sunscreens we use, the more skin cancers we're seeing. I believe the sun can actually prevent cancers and other diseases. So don't be fooled. We absolutely need sun to be healthy. So just to kind of touch on some of the things, positive benefits that vitamin D can have. When we look at sunlight and cancer, medical and scientific research demonstrates that the risk of 20 major cancers is reduced by regular sunlight exposure. These include the big three: breast, prostate, and colon. Do you realize that melanoma risk increases as sun exposure decreases? That's right. In 1900, about 75% of the U.S. population worked outdoors. Today, only 10% of the population does. So again, just as I mentioned, our current society, we work inside, we drive in cars, and if we do outside, we keep ourselves mostly covered and most likely wear sunscreen. So even as sun exposure has dramatically decreased, the melanoma incidents have exponentially increased by 2,500% since the 1900s. So again, there's a kind of weak link there between sun and the most deadly form of cancer, skin cancer, and that's melanoma. Astonishingly, melanoma rates increase only in indoor workers, not outdoor workers. 78% of all melanomas occur in areas of the body that are seldom exposed to sunlight, like the bottom of your feet. Melanomas also occur inside sexual organs, or the soles of the feet, in your mouth, your armpits. Again, all these areas receive little sun or no sun exposure. So, again, cancer is a metabolic problem, not just a problem with exposure to the sun. Another causal factor is the increased use of sunscreen. As I mentioned, when we use sunscreen, this is only protecting us from one of the potential rays, UVB, and the UVA and UVC actually penetrates deeper, but by using the sunscreens, we're able to stay in the sun much longer. In the past, before sunscreens, we would get under an umbrella or stay out of the sun for fear of getting burned. Sunlight and heart disease. Heart disease can be related to the amount of sunlight and vitamin D exposure that you get. Studies show that if you have low vitamin D3 levels, you have a 2.4 times greater risk of heart attack as those with the highest vitamin D levels. Men with the lowest vitamin D levels have nearly 6 times the risk of hypertension as those with the highest levels. Women have just 3 times the risk of hypertension if their vitamin D levels are low. Osteoporosis and fractures. An interesting study was done with women with osteoporosis. They were taken outside for sun baths for a year, resulting in a 3.3% increase in bone mass and a reduced fracture risk of 1/6 compared to those women who did not sunbathe. So the sunbathers actually increased their vitamin D levels by 400%. Vitamin D and depression. One research study showed that elderly people who had the lowest levels of vitamin D were 11.7 times as likely to suffer from mood disorders as those who had the highest vitamin D levels. Vitamin D and chronic pain. A most impressive clinical observation of 5 vitamin D deficient patients who suffered from myopathy. A decrease of bone and muscle tissue proves that vitamin D helps relieve pain. Patients were confined to wheelchairs and experienced severe fatigue, weakness, and chronic pain after receiving 50,000 international units a week of vitamin D. All regained enough strength and energy within 4 to 6 weeks to be mobile and functional, and their aches and pains disappeared. Vitamin D is not a vitamin. And most people think of vitamin D as a vitamin, but in reality, the active form of vitamin D is one of the most potent hormones in your body and essential for health. Vitamin D is produced as a prohormone in your skin after sunlight exposure. So this is an important point because the vitamin D that we get from the sun is a vitamin D sulfate. And the vitamin D3 that we take as a supplement is not quite the same, and some research is showing that getting your vitamin D from the sun is much more effective at preventing our bodies from different hormonal disorders. So, without this hormone, you could die. And indeed, many people do die from vitamin D deficiency related issues. So, discover the way to health, restoration for you and your family by returning to a healthy lifestyle that includes sunlight and vitamin D. So that's it for the very first of the 5 most common vitamin deficiencies in America. On this next video, we're going to talk about vitamin K. So this is Dr. Scott talking about the top 5 vitamin deficiencies in America. See you on the next video.